Welcome to an episode of Reboot with Dr. Arasi Maran. I am Arasi Maran. I'm an interventional cardiologist practicing at the Medical University of South Carolina. But this podcast initiative is completely separate from my teaching responsibilities in the university. The goal of this podcast is to bring you evidence backed science and to convince you that you can always reclaim and reboot your health and life at any time. This podcast is going to be set up in a different fashion. I have a newly minted doctor in my family, my niece, Dr. Divya Maran. She is going to play host and ask me questions about the various medical myths she has come across. So, over to Dr. Divya Maran.
Thank you so much. I'm so happy to be here. I think this is the first thing we're doing together as doctors in the family, and I think that's really exciting, and I can't wait to do this.
Yes, I am thrilled. I think this is the first of many things we will do together as doctors. Forget the aunt and niece bond. So this is pretty chill. So what do you want to talk about today?
How about some medical myths?
Sure, shoot.
So, one of the medical myths I've heard like most is on statins, and it people just don't want to take statins because of the side effects.
Yeah, so statin is like a hero which everyone loves to hate. Okay, statin is such a commonly used medicine for the heart. Statin comes under the drug names of atorvastatin, pravastatin, simvastatin, rosuvastatin. The commercial names are Lipitor, Zocor, Crestor, etc. And the reason statins are loved by us cardiologists is because it reduces the levels of bad cholesterol or the low density lipoproteins. And with every millimole per liter decrease in the LDL, there's a 20 to 25% decrease in the mortality from heart attacks. So we love it for heart patients. We also not only give it for patients who've had a heart attack, but we give it for patients who are at high risk for heart disease, such as patients with high blood pressure, high cholesterol, history of stroke, history of smoking, family history of heart disease, or those with a very high calcium score. We give that to them, irrespective of the LDL levels, because yes, statins decreases the cholesterol levels. It also has another very important function, which is called the pleiotropic effect. It basically I'm going to go a little bit into basic science, so bear with me. So when we start producing a plaque, there's a lipid core, okay? And over the lipid core is a thin membrane. It can be a thick membrane or a thin membrane. When there's a thin membrane, for whatever terms, whatever stress we have, sleep deprivation, cortisol excess, that membrane can rupture, the lipid core gets exposed, and then a blood clot forms, and that gives rise to a heart attack. But for those patients who are on statins, it stabilizes the thin membrane, okay, and therefore converts a vulnerable plaque into a stable plaque and prevents heart disease. So it's a great medication for that. But unfortunately, there's no free lunch in life, right? So every medication comes with side effects also. And statins can cause muscle cramps, but only 10% of the population has muscle cramps. So, but and in those patients, we can give them coenzyme Q10, or sometimes we even ask them to take it every other day. And if one brand of statin gives them muscle cramps, you can switch to another brand. So you can, play around. They're not twins, they are cousins. So you could play around and see which one suits you the best. Okay, so that's the most common side effect of the statin. In some patients, it can cause really muscle damage. We call it rhabdomyolysis. That's very, very rare. So, that's not a thing which we need to worry about. But again, if they take it and they have unbearable muscle cramps, and the urine is high colored, dark colored, then you have to think about that. It can cause liver function, liver disease, or not liver disease. It causes elevation of the liver enzymes, okay? And so we always take a baseline liver function test, and within the first 3 months, we get a repeat test to make sure the liver enzymes are stable. And we can adjust the dose and things like that. So, These are the two most common, though there is a concern about it increases the hemoglobin A1C and pushes pre-diabetic people to diabetic. It is not like that. It does. The evidence does show it raises the hemoglobin A1C by by a small amount. But it is mostly a high risk patient, a patient who was already at high risk, and if they haven't changed their dietary behavior, etc., it can push them. But despite all that, the overwhelming evidence, there's so many trials which has said that statins actually reduces the incidence. If you've not had a heart attack and you're high risk, it delays your occurrence of heart attack. If you've had a heart attack, it prevents your second heart attack by several years. So statin is a very important drug. And again, people love to hate it.
Well, that was very well explained. How about the myth that if you have high blood pressure, you can feel it?
No. Blood pressure is actually called a silent killer for exactly this misconception. You don't feel blood pressure. I have patients who come to the clinic and say, "Oh, my blood pressure was 140. I had really severe headache." I'm like, "No. If your blood pressure is 180, you can potentially feel a headache because you're probably having a small stroke or something like that. But you don't feel your blood pressure. You can feel low blood pressures. You can get dizzy, etc. But I have people very happily walking around with blood pressures in the 200s without having any sort of awareness that their blood pressure is high. So the only way you can figure out whether your blood pressure is high or the normal range is actually by checking your blood pressure. So the recommendation is that once you hit 30, every year you should get a physical, and you should check your blood pressure along the time. And you need not go to a doctor to get your blood pressure checked. Most pharmacies and grocery stores, even gyms have that blood pressure machine, and you can just get it checked there.
That was very well explained. How about this? Let's dive into this. Heart diseases are more common in men than women.
That irritates me. That misconception just annoys me so much, because it is a disease of us as a human race. Okay, men are getting heart disease, women are getting heart disease as much as men. Unfortunately, in the past, it was one little advantage we had in life till we were in our menstrual cycle. The estrogen used to protect us, and estrogen is cardioprotective, and the average age of heart disease in women was 65, because that's when they complete their menopause and they're completely the postmenopausal state. But thanks to the ultra processed food industry, our dietary habits are so messed up right now that there are a lot of women who get heart disease and blockages as much as the men. I mean, I can tell you the story. The problem with women is they don't get the same kind of symptoms like men. There's a Levin sign. I'm sure you've read it in your medicine thing, where it's an elephant sitting in the chest. That's the common description for a man who's having a heart attack. Women don't feel that at all. Women are like, "Oh yeah, I just have a little jaw pain. Oh, my neck feels tight." Or, "I'm just short of breath. I'm old. I haven't exercised. I'm just out of shape." And they don't have the classic symptoms of heart attacks at all. So it gets missed. So they are another at-risk population where the symptoms are so all over the place, and they come for treatment late. And they also, when they come to the emergency rooms, even doctors fall for this misconception and don't look for heart attacks or heart disease in women, and they get pushed back to "Oh, you're fine, you're some anxiety pills, just go for a walk," or some sort of patronizing nonsense. When I first started practicing in 2012, I will never forget the story. She was one of my first patients. This is a 38-year-old woman. Okay, I'm aging myself. I was also the same age, and she wanted to get pregnant. I was very puzzled. I'm like, "What are you talking? What's going on?" So she was a triathlete, okay, and she trains other adults to bike, cycle, and swim. And she was having chest pain. They would put her on a treadmill. Of course, she's a triathlete, so she could pass all those stress tests easily without any problem. And then one day she comes to the emergency room with crushing chest pain, and they find that she has a clot in the main blood vessel. And they also found out that she was 6 weeks pregnant at the same time with her first baby. So she had to have a medical termination of her pregnancy and had to go for emergency open heart surgery. So she was in tears. She was in tears like, you can please tell me I can have a family. Please tell me it's okay for me to, figure how we figure this out. So we did multiple tests for her, did a repeat cath. Her blood vessels were okay. We monitored her closely. She had a baby, and actually, when I was pregnant with my third child, she was pregnant with her first child, and we have pictures of us. Together and things like that, and she brings her baby to me. So, but this woman, if she had gotten the appropriate treatment, maybe she would have just gotten a stent and she would have gone on with her merry life and would not have had to have, the trauma of losing a pregnancy. That was very, very unfortunate. And she was young, and this happened to her. So, yes, women can get heart disease as much as a man, and this is very unfortunate. So we have to, this unconscious bias, we need to get over that.
That was a very touching story. Talking about treadmills, how about the myth that if you have a heart disease, you cannot work out or go to the gym?
So that sounds more like an excuse, a very convenient excuse. No, that's a complete myth. That's total bogus BS nonsense. Yes, but a person who's had a heart attack, let's say they had a heart attack, I don't know, 5 days ago, okay, and they received a stent because of the heart attack. We give them a week to 2 days, 2 weeks not to do any kind of extensive exercise because the body has gone through a trauma. So wait for everything to rest up and heal up. And we refer them to what we call as a cardiac rehabilitation program. When you go to the cardiac rehabilitation program, then you basically they do a stress test there. And when they do a stress test there, they figure out how your EKG is, how is the patient responding to the exercise itself, and they step up the exercise, graded exercising is what we call it. They meet with an exercise physiologist who increases the exercise levels very stably. Some of the young patients, they come for cardiac rehab and they are like, I can do much more tough stuff than this. I really don't need to be a part of cardiac rehab. And they come for 3 or 4 times and they go back to exercising. The difference is before you had a heart attack, it is mind over matters. You can push yourself, you can push your body, but after you've had a heart attack, you need to listen to your body. If you're exercising and you're pushing yourself, and you either get very short of breath or you feel a little discomfort in your chest, you need to stop. That won't be the time where I'm going to go for broke and I'm going to do that extra 10 push-ups, etc. That is not recommended, but it is strongly recommended you exercise both cardio and strength training. So yes, please exercise after you've had a heart attack also. Not immediately, but later on.
So this is another common one I've heard. If you have family history of heart diseases, you're going to get heart disease.
It's not a myth, but it's also not a myth. Okay, let me explain. You can't change your genes, right? You are what you are born with, but you can manage them better. Okay, so if you have family history of heart disease, let's talk about two options. Family history of heart disease, but does not do any kind of risk factor modification. That person eats what they want, does not exercise, does not, leads a very sedentary life, etc. That person, unfortunately, because of family history plus everything else, will end up with a heart attack. That patient can potentially have a large heart attack. Let's talk about option B. yes, I know I have a family history of heart disease, and because of that, I'm going to manage my cholesterol, I'm going to manage my blood pressure, I'm going to manage my blood sugar, I'm going to exercise really, really well. And that person is usually much more mindful about what's happening with their body, and usually be like, I could run 3 miles last week without any problems, but this week I'm kind of huffing and puffing at mile 2. Let me go check with the doctor. They could come and check with the doctor, and we'll do a stress test, heart cath, whatever, and they may have blockages, and we put a stent in, and we have prevented a heart attack. That's number one. Number two, even if they have a heart attack, even if they, skip all those symptoms and end up with a heart attack, because they had managed all other risk factors, it will be a much, much smaller heart attack compared to the other person who had risk factors but did not modify the risk factors. Okay, so it is plus or minus of both. Yes, you can't change your genes, but you can do a phenomenal job of managing other risk factors. So that's the only curveball in your life. Does it make sense to you?
Yeah, it's like the modifiable risk factors that they can modify, the things that you can't do anything about are genetics and age, but like not smoking and all is supposed to help, right?
Absolutely, absolutely.
Yeah. How about this? So, a lot of people think that a cardiac arrest is the same thing as heart failure. What are your thoughts?
Wow. Okay. Let's go back to basics. Okay. Okay. Yes, heart failure and cardiac arrest are considered the same thing. So they think it's the same thing, but it's not. So let me start with a little bit of very oversimplified physiology. Okay, we're not going to go into the 4 chambers or anything. The heart is a pump. Oh, it's an engine. Okay, any pump needs an engine like a motor current. Okay, it needs a fuel line, and it also needs an electrical supply. Okay, I come as an interventional cardiologist. I deal with the fuel line. Okay, I make sure the plumbing is great, that is, the blood flow is great, etc., so that the pump can keep going. If the pump stops working for whatever reason, it can be because the fuel line got chugged up, or because the electrical supply got blocked. So the pump completely stops failing. Okay, then that's cardiac arrest. Okay, but if the pump just becomes a weaker pump, okay, and it's not doing its job of pumping out the fluid or receiving the fluid, it's not doing its what it's supposed to do, because of, it can be because of a fuel line problem, it can be because of an electrical problem, it can be because of a very faulty engine. For whatever reason, the pump is not working efficiently. That's heart failure. So one, in heart cardiac arrest, the heart just stops working. Or, I mean, there are different variations. We won't go into that, but it's just it's a standstill. Okay, the patient does not have a blood pressure. You pass out, and you have to be revived, or you need some medications which need to be injected to get to restart your heart. Whereas cardiac failure is more weakening of the engine for different reasons.
I love the analogy and the way you explained that. I think that was just perfect. How about this one? A lot of people believe that if they have heart surgery and their heart is fixed, and it's always going to be healthy.
Okay,
How
interesting, interesting. All right, so this is the harsh truth of medicine. There are very few things we have an absolute cure for. Okay, if you have a bacterial pneumonia, I can give you antibiotics, I can cure the infection. Okay, so the pneumonia is cured, you're cured of pneumonia. But when you have blockages in the blood vessels of the heart, I have fixed the problem either with stents or with open heart surgery, but I have not cured you of the disease, which is coronary artery disease. I have bypassed the problem areas, but you can still develop new blockages beyond the bypass. Or if I have put stents, you can still get new blockages beyond the stents or within the stents too. Yes, bypass open heart surgery or stents, it fixes the problem of chest pain, difficulty breathing, shortness of breath, heart attacks, etc. It fixes the problem. It does not cure coronary artery disease. We never cure coronary artery disease. We are not in 2024. We cannot cure coronary artery disease, but we can manage it very, very efficiently.
That was very well said, and I hope all our listeners are listening to this right now. I've also heard, I mean, from a lot of the younger patients that they're not worried about getting a heart disease because they think it's only for only older people get heart diseases. What do you have to say to them?
I just want to sigh. Well, the first example I gave you was a woman when she was 34 years old. I have another female patient at 36 years old who ended up with the open heart surgery. And very recently, this year, on January 1st, we had a 27-year-old die of heart disease, die of a heart attack. I mean, that person probably brings everything together. He was 27 years old. He was a trainer, and he had a very strong family history of heart disease. Obviously, very active young person, was hiking and exercising, but was having symptoms of chest pain and difficulty breathing. The mother said, you should go check. But which youngster listened to their mothers, including yours? We can talk about that. But did not listen, pushed themselves, and the patient did not make it. No, in this day and age, with all the environmental toxin, with all the food related, processed food related, this vaping culture, smoking culture, energy drink culture, hormone replacement. Let me get a quick fix of all whatever nonsense culture. No, it's not just for the 55-year-olds and the 65-year-olds anymore. I'm increasingly seeing it's shifted by almost 10 to 15 years. It is very, very scary. It is very, very unfortunate. And honestly, that's what pushed me to start the podcast because I'm like, what is going on with this world? I mean, I felt like me doing my work within the walls of the clinic or within the walls of the cath lab is not enough. That we need to talk to the younger generation that for God's sakes, please take better care of yourselves. We used to think the 20s and 30s were the immortal time where you can eat whatever you want and do whatever you want and your body can take it. It is, I'm sorry, you guys. You guys have social media, you guys have Wi Fi, you have internet, you have smartphones. With all of that, you also have received the burden of premature diseases. So please take care of your health. Did you hear me, Divya?
Yeah, I heard you loud and clear. That was a good answer. Here's another myth that I love. You don't have to worry about heart diseases if you're not overweight.
Oh, wow. Good one. That's a good one. Okay. Yes. Okay. Yes. Obesity is a risk factor for blockages in the blood vessels of the heart because obesity leads to diabetes and diabetes leads to blockages in the blood vessels of the heart. Yes. But just because you are thin, it does not mean you are completely safe from that because there is this term, especially us South Asians, thin on the outside, fat on the inside. You're super thin, skinny legs, skinny arms, just a little belly fat, just a little, not a whole lot or something. That visceral fat can predispose you to so much inflammation, and that fat is basically surrounding all your organs, including your heart. So that is completely, just because you're thin, just because your BMI is within the normal range, it does not mean you don't have a risk factor. You're not prone for heart disease. Let's flip this other side. Most smokers are very thin, right? In the 1970s and all, they literally advertised smoking as a weight loss drug. Okay, women were asked to encourage to smoke because they can be nice and thin. Those people have the worst heart disease. Their blood vessels are so calcified. I don't even have to. I can just look at the face and I'm like, oh, you smoke, right? Because there are telltale signs because they get accelerated aging, etc. They'll be skinny thin, extremely thin, but they literally have such aggressive heart disease because, as you know, smoking, nicotine is like a forest fire. It just inflames everything head to toe when people take it. Yeah, they are thin and they are extremely prone. They have very aggressive heart disease. Pre-diabetic South Asians, they are very thin. They are extremely prone to blockages in the blood vessels of the heart. No. Yes, obesity is a risk factor, but so then you can also ask me then who is safe from heart disease, etc. There, life happens, but there are things you can do that when it happens, it is not a big blow. So the way I say it, you drive safe in a car, you wear a seatbelt in a car. So if you meet with an accident, you just have a mind scratch. That's what we're all aiming for. Exercising, eating well, sleeping well, taking care of yourself, making sure all your modifiable risk factors such as high blood pressure, high cholesterol, everything is within thing, because in case something happens, you can get over it, recover from it, and you can push the time when it happens to much faster, much later. Sorry. Does that help you?
Yeah. So I guess lifestyle modifications and balance is key. That's what I'm getting from this.
Absolutely. That's the message. Lifestyle, a healthy lifestyle. The diet has a start date, but does not have an end date. Okay. Just because get off the wagon for 1 day or 2 days does not mean you just do not get back on the wagon. It's, the thing I say is, if you are going from your house to your office and you took a wrong turn, you don't keep taking wrong turns and say, oh, I'm anyway off track. Let me just be off track. You will turn around and come back to the correct pathway, right? That's how life is. So, lifestyle modification. And what is lifestyle modification? It is just eating real food. Before I used to say food is thy medicine. That's what Hippocrates, that's his quote, very famous quote. But I think now we have to shift it to real food is thy medicine. And exercise is the best antidepressant you can ever have. I mean, and just no one. There's no free lunch. You can't have bad behavior, bad food habits, and say, "Oh, everything has to be fixed." It does not work that way.
I love how we've spoken so much about rebooting people's lifestyles. I just wanted to know if you had any personal experience like rebooting your lifestyle. I mean, after getting into your career.
Absolutely. So I have, committed all the crimes I've asked you not to commit. Okay, that's why I feel comfortable telling you, please don't do what I've done, because it's so hard. In my 30s, I had three pregnancies, right? 31, 34, 38. So it was pregnancy, postpartum, weight gain, pregnancy, postpartum, weight gain, pregnancy, postpartum, weight gain. I was also doing my fellowship. I literally would, and my interventional fellowship was truly one of the hardest things I've ever done. I would leave the house at like 5 o'clock, come back at 8 o'clock, 9 o'clock, and just eat whatever I needed to survive, to keep my head above the water. It was really, really, really tough. Then my daughter was born. I mean, I was a geriatric pregnancy. I had her very late in my life, and she fell very sick after, and thankfully she's fine. Everything was okay. But after that was a big. It broke my system almost. I developed with severe Hashimoto's thyroiditis. I had a toxic flare, and I burnt out with absolutely no thyroid hormone production. And my joints started aching. I gained a bunch of weight, and I was like, "Oh my God, this is becoming crazy." This is I really was like, if I don't catch myself and I don't reboot myself, I would have had to stop working, or I would have had to stop doing my favorite thing in the world, which is my cardiac catheterization, because my back was hurting. And so when I turned 40 years old, I literally looked at myself in the mirror long and hard, made a checklist of all the things that was wrong with me, and like literally made it my mission to work on it, including my mood swings, my temper tantrums, and my unreasonable demands out of life, and my chocolate addiction, and my soda addiction. And it was, I'm not going to say I've won all of it, but I am working hard towards it. I've controlled it. I have, because otherwise I would have been in the hospital, or now I'm true. I definitely went through a phase of, oh, I want to be super thin. And then now I'm in a phase of I'm going to bulk up and build muscle. So yeah, I'm constantly rebooting myself, but that was a very intentional reboot. Yes.
That's actually such an inspiring story. I'm like so happy to see someone who actually follows what they preach.
Well, I didn't follow it initially.
Yeah, but you did, and you ended up following it in the end.
Yes,
and it all worked out.
Honestly, I don't right now preach anything which I can't follow. Seriously, that has become the thing. And of all people, I think I understand how hard it is, right? If I want to exercise, I have to wake up at 5 o'clock. And if I'm on call and I don't go to bed till 11 p.m., I'm not going to be able to wake up at 5 a.m. to exercise. So, but it's okay. I mean, just because I miss exercising 2 days, it does not mean my whole week is gone. So I'm sometimes a weekend warrior. I'll exercise more on the weekends than on the weekdays if it's a busy week. It is not a perfect plan, but it's my plan and it's working for me. And I'm constantly checking my plan and changing my plan and tweaking my plan. And that's what I think that's the biggest message. Don't be stuck on, this is the only way it will work. If this is not working, find another way. Don't be like, oh, this is not working, I'm giving up. I'm never going to attempt to reclaim my health. That is not, that is not the point of this.
It's so nice to hear a real story and your real experiences. I mean, I guess you can have it all with you. You have a really good balance, and I'm really inspired and motivated by that. And I hope whoever's listening to us is also inspired and motivated. That was great, and I had so much fun doing this with you.
Thank you. This was so much fun doing with you also. We both are Librans, so we both are all about balancing lives, right? The scale is not always perfectly still. It leans one way or the other, but it's okay. It's there. We go with that. Well, thank you so much for being my host in the show. I had so much of fun. And thank you all for those who are listening. And if you have questions, comments, or there are more medical myths you would like us to discuss, please send us a message and we would love to get back to you. And with that, goodbye and see you later.
Bye.
Thank you so much for listening. If you found us valuable, you can subscribe to the show on Apple Podcasts, Spotify, or any of your favorite podcast app. And also, please consider leaving us a rating or a review, as that helps others find the podcast too. I hope you have a great week ahead.